Okay, so I'm gonna explain this article, this research article. So it's the relationship between the self-esteem of nurses and their choice of strategies to cope with the workload burden. So this is an important study because nurses have high workloads, they're stressed, they're burned out, which affect their mental health and job satisfaction and patient care quality. So self-esteem plays a crucial role in determining how nurses manage their stress and their coping mechanisms. So understanding the relationship between better support programs, trainings, and interventions improve nurse resilience. So the best goals and ways to examine how your self-esteem levels influence nurse coping strategies is to determine if your higher self-esteem is linked to problem-focused coping or like seeking support or time management, and to identify the low self-esteem leads to emotion-focused coping like avoidance and venting. So, to provide evidence-based recommendations for healthcare institutions to support nurses, so they can support nurses' mental well-being. So, the literature review and background part of it is the Lazarus and Folkman's 1984 stress and coping theory. So, it differentiates between problem-focused coping and actively addressing your stressors. So, emotion-focused coping, managing emotional responses. So, another theory is the Rosenberg 1965 self-esteem theory, which highlights how self-esteem influences behavior and decision making in stressful situations. So, I'm going to talk about some previous research findings based on like high workload burdens for nurses, and nurses being burned out, having anxiety, and problem-focused coping leading to better job performance and stress reduction. So emotion-focused coping is linked to an increased emotional distress and exhaustion. So self-esteem impacts coping choices, mental resilience, and job satisfaction. So basically, stressful situations, anxiety, and burnout on nurses affect them a lot when they take care of patients. So some research methods that I found is like a study design. It's a cross-sectional quantitative study conducted in hospitals, clinics, and long-term facilities. So they can do like a study related to like hospitals, clinics, and long-term care facilities. So like participating in sampling. So a sample like a licensed nurse working in a direct patient care. So active patient care nurses. So your criteria will be nurses in non-clinical roles or extended leave. So the data collection tools on the Rosenberg self-esteem scale measures self-esteem levels, and coping strategies questionnaire evaluates coping mechanisms, problem-focused versus emotions. So those are some tools that can help in the research and study programs for hospitals and clinics. And some data analysis tests to identify relationships between self-esteem and coping strategies. So your ANOVA test compares coping preferences across different nursing demographics. So some research findings are that self-esteem levels among nurses was found to be a diverse range of self-esteem levels in nurses. So coping strategies used for nurses with high self-esteem, they performed problem-focused coping strategies, time management, seeking support, and proactive problems better showed greater resilience and job satisfaction. So the nurses that have high self-esteem. High self-esteem. And nurses that have a low self-esteem, they rely more on emotional focused coping, like avoidance, venting, and self-isolation. So it's more stressful, it's burnout and emotional exhaustion. They're going to burn out quicker. So a correlation between self-esteem and coping is a positive correlation is that high self-esteem is adaptive. So your high self-esteem is adaptive coping mechanisms. Your negative correlation is low self-esteem, which they don't have very good coping mechanisms. So, my discussion and practical implications of the findings are that nurses with high self-esteem use coping strategies to improve resilience and reduce burnout. So your nurses with low self-esteem are more vulnerable to stress-related emotional exhaustion. So a comparison with the existing research is that the findings align with previous studies finding that self-esteem affects stress resilience in healthcare professionals. So they need to reinforce the notation that problem-focused coping strategies improve work performance and reduce mental strain. So some recommendations for nursing practice would be a workplace intervention. So like they could implement mentorship programs and self-esteem workshops. So some training and stress management programs for nurses to help provide coping strategies, training for nurses with low self-esteem. So some organized policies will be good because it encourages mental health support, leadership engagement, and work balance life. Working your work-life balance. And to conclude this video, self-esteem sufficiently influences nurses' coping strategies. So the higher the self-esteem, problem-focused coping, it's better because nurses can adapt better to stress management and anxiety. So if you have low self-esteem, it's more emotion-focused coping, so you're gonna have burnout and exhaustion quicker. So some programs can be provided in the healthcare institutions for nurses, so they can like programs to help boost self-esteem. It could be like creating a supportive work environment that also leads to better nurse well-being and improved patient care. So future like research directions would be like the long-term impact of self-esteem interventions. So exploring like other psychological factors affecting nurse stress and coping. So basically this article is about nurses and how like the high workloads, the stress, the burnout, the anxiety, the like all the negative stuff impacts nurses in how they're providing patient care. So, you know, obviously from the research, the high self-esteem nurses are like manage stress and coping mechanisms better than your low self-esteem nurses, because they get burned out quicker because they don't have good coping mechanisms for like high workloads and stress and stuff. So there I provided some data, some research findings, some studies, some like programs that can be implemented in the hospitals to help nurses. And you know, basically I think this is a good idea because there is a lot of overstressed nurses, and I think that nurses should take care of their mental health more and better. So I think it should be provided more in the hospitals and clinics and stuff. So that's about it. Thank you.